think one of our goals is to reshape the future of pulmonary care.
It really is the multidisciplinary team. And I think the team at Penn is really what makes it special.
All those people working together and meeting together, we end up with thinking about disease differently.
At Penn Medicine Harron Lung Center, it's about balance, depth, and breadth across all major lung diseases. Patients benefit from a team of internationally recognized experts, and the field of pulmonary medicine benefits from innovative clinical, translational, and bench research. There's also a sharp focus on reducing disparities and improving access and representation within the profession itself. It's a defining characteristic at Penn Medicine Harron Lung Center.
Extraordinary breadth, depth, and balance across the division so that patients are getting the benefit of a team of experts. I think that's really a unique defining thing about the Harron Lung Center.
Coordinated, individualized care from leaders in all aspects of advanced and complex lung diseases.
We have programs of excellence across the board, right? We have interstitial lung disease, pulmonary hypertension, lung transplantation, COPD, interventional pulmonary thoracic oncology, allergy, immunology, and the list keeps going on.
But just as importantly, physical therapists, pharmacists, respiratory therapists, nutritionists, social workers, financial coordinators, who all work together in a seamless manner to make sure that all of the patient's needs are taken care of.
Multidisciplinary teams, and each person within each program is a disease expert.
There are horizontally integrated clinical disease experts, people who are experts in education, people who are clinical translational researchers integrated with more fundamental researchers. So that iteration allows us both to have the greatest clinical care, but also to have that clinical care inform the science to push the whole field forward. We have it all laid out that way, right? And there aren't any weaknesses.
Moving the field forward through active, state-of-the-art clinical trials.
Trying to understand both mechanisms that lead to acute respiratory distress syndrome, as well as trying to find markers either in the plasma or whole blood that might help us distinguish what pattern of response patients have, and maybe that would lead to more personalized treatment for patients.
Collaborative research and discoveries, including novel cell types.
So this human-derived cells have really enabled this research, and now we can try to understand what is the role of that cell in disease such as COPD.
Innovative approaches to patients suffering from COPD inspired a unique program to reduce hospital readmissions.
What our physicians did as a very innovative pilot was they worked together with our emergency medical services in the city to partner that when those patients called 911, that the call would go directly to the team of COPD physicians as well as an emergency medicine trained nurse who would actually go to that patient's house right away and see if there was something that they could do to help them in this acute breathlessness.
And we found that in our program, 3/4 of patients thought they might need to go to the emergency room. They didn't need to be hospitalized. This pilot program has been so successful now that we've partnered with Independence Blue Cross to extend it now to all 3 of our downtown hospitals.
Improving access to care while reducing long-standing health disparities, such as a test now known for inaccuracies.
Making some changes to our pulmonary function testing lab to ensure that our Black patients in our ICU, and really all patients with darker skin tones, are getting the appropriate amount of oxygen, addressing this disparity.
And improving representation within the profession.
And we've done it systematically by changing our recruiting practices and changing our interview practices. We have been able to recruit several more fellows from underrepresented backgrounds, and just the same as it improves patient care to see someone that looks like you and that comes from your background, it also improves learning to have people from different areas.
All the while pushing the boundaries of the most advanced stage of lung disease when patients face lung transplantation.
We've shown here at Penn that many of these patients can be transplanted safely, and in fact, our outcomes for this really high-risk group of patients is just as good as patients who don't have as many comorbidities.
The impact of care that always comes back to the team, a team that extends expertise outside the walls of Penn and well beyond our city limits.
So Dr. Ahmed, during the pandemic, looked in our country and said, where's their need? And so she developed a partnership with Indian Health Services.
To use different ICU technologies like ultrasound in order to improve the care and the outcomes for the patients in Navajo Nation.
Penn Medicine and our lung center is really passionate and committed to the tripartite mission of providing the best clinical care now, researching these terrible diseases, and also in education so that we may train future pulmonologists and transplant specialists.
Helping the world to breathe by really fostering the next generation of leaders in pulmonary and critical care medicine.
There's many different ways that we make leaders in medical education, and there's many different roles that people play that impact the community and patient care, and we wanted to build a space for that.
One of the things that I am most proud of is among all the great programs in the nation, we were ranked number 8 by U.S. News & World Report for pulmonary and lung surgery, number 1 in the region and number 1 in Pennsylvania. I think it's just a reflection of just the commitment to patient care that we've put, because the quality metrics that are subsumed in that are things that are just in our fiber. These are things that we're passionate about.